Thank you. So my topic is a new focused ultrasound strategy for T2 hyperintense uterine fibroid and adenomyosis. If we have experience of hyperablation, we will encounter T2 hyperintensity, which is a contraindication. That's not the case. While there are a lot of contraindications, whether it's type 1 or type 2. So for those under the perimetrium, some people said it was not possible. We did that. We did some explorations to 20 centimeters, and now it's the hyperintensity. And I will skip the development of focused ultrasound ablation. And this is really a great equipment. I used other companies' equipment before, and to compare, this is the best one because it has the best ablation and best efficacy. We used the ultrasound guided. Ultrasound guided is better because it is quite intuitive. But via vagina, when patient moves, the accuracy is a problem. After the ablation, it may cause some heat, but if I use the ultrasound guided HIFU, if there's some residue, we can see that use enhanced imaging and we can continue the ablation. So these are the approaches of focused ultrasound applied. So there are a lot of cases and studies around the world. One thing we do is that POI 和 PCOS 段子的卵子，就是卵子的形成。So we stimulate the ovarian for POI and PSOC patients using focused ultrasound. So we want to do a PCOS or POI clinical study. It can actually stimulate the ovarian, and the female can start to have menstrual again. So this is a new one that I want to mention. One layer, the rear layer. So the energy of the focused ultrasound can be used to have 100% ablation and avoid the high temperature and burn of the skin. Of course, there are skills involved. Why I want to do 100% ablation? Because we're going to have a competition with GYN. I'm an intervention knowledgeist. If I do not this good, and GYN would say that this doctor is not okay. We have GYN has alternatives, but for us, we do not have alternative. So we want to have 100% ablation to have better clinical results. This is also a result categorization based on a doctor from Japan, but that's not the case how we classify. This is the T2 signal. It's easy to ablate this one. Well, this is MRI guided. It's okay that we can do it. And this is a huge fibrosis with a rich blood supply. And if we see the MRI, you can see a lot of blood vessels. We can do 100% ablation even for this. So I published an article that So different from the RFID and microwave for focused ultrasound, there's basically no heating-seeking effect. So no matter what, it's best for us to cut the blood supply. So for T2 hyperintensive signals, there may be some influences. Another case that I want to share with you is T2 hyperintensity. Well, the mild ones are the most difficult ones. We can see very rich blood supply, and we also achieved 100% ablation, the best performance player. So we are doing it as an art piece to avoid recurrence after intervention. So this is fibroid, another case. Maybe there's some residue after ablation. The residue may cause recurrence. So I paid very closely attention, and we did a lot of irradiation, and we can see really light colors. So even if when the temperature is very high, the ablation is not good. So I assume that after 6 months there will be reoccurrence, and the patients would say that it's not good, and the surgeons would say it's not good. Open surgery is the best. But that's not the case. T2 signal intensity, even it's high or low, can achieve 100% ablation. So this is T2 hyperintensity with rich blood supply. Well, the little residue will cause reoccurrence. Also, the mass volume is reduced, but after 2 or 3 years, there will be fibroids again. This bothers us. We can treat it for the second time, but it will be difficult. Another case, this patient wants to do non-invasive. It has T2 hyperintensity. We had a try. After treatment, maybe 5% of ablation. How about that? The patient has had hope. What's the solution? We have to have some new solutions. At the very beginning, we use ethyl iodized oil to change the structure within the fibroid. So it's useful, but not as good as Loroma. So this was used for anesthesia. So in 1993, it is used to stop the vein. So I saw a case to inject the Loroma. Well, this has overspill, but that can be actually very safe. So I studied to use the Loroma as a substitute. It has also been, this practice written into the expert consensus. So it's easy and safe. They are injecting the Loroma alcohol. So this one, we can champion a new practice. And we also use the low-dose mifepristone or subcutaneous injection. They are just aiding methods. This is after we inject ethyl iodized oil. For low-intensity ones, it's good, but for high-intensity ones, it's not good. maybe it will not grow up, but to reduce it's difficult. So this case, another patient, 44-year-old with T2 high intensity, we thought it won't do directly with HIFU, and after the TCM treatment, the fibrosis went up, and we administered a low-dose mifepristone, and this patient insisted that she use the non-invasive method. She doesn't want open surgery, so we use loral macrogal injections, and then HIFU guided by ultrasound. After injection, we can see the image. 10 minutes later, we treat HIFU, so it's perfect. So for this case, the doctors may feel it's difficult, but we can do it. There's another one with T2 hyperintensity. Patients would suffer pain if we directly go with HIFU, but we can actually administer the loral macrogal. Well, some people say that there's no pathological tests when we do the treatment. We actually do a full array of tests of labs, and we even study why the fibrosis shrinks and then it goes up. And we also study why the ablation do not occur 100%, but the fibrosis keeps shrinking. So this is another patient, hyperintensity, thought to be impossible. The fibrosis went up, and then we had HIFU directly. There is no result. The mass keeps going up. So we can also inject loral macrogal. We can see very obvious shrink. So if you are not successful directly with HIFU, you can try with the loral macrogal. This is another patient with T2 hyperintensity, DBRS high, KI 67, less than 1%. And we can see a needle going in. So the posterior, we injected the loral macrogal. After that, with HIFU, it's perfect. Another case I want to share with you, low intensity. We thought it would be very successful. We were very confident after treatment. We can see the result. The ultrasound contrast enhanced ultrasound. We did not find blood supply, but after the loral macrogal combination, we can have 90% of ablation. And this patient is about to conceive, and she wants to have 100% ablation. We think it's okay. The energy should be controlled within 250 joule, because after that we can see some neural lesions, the burn of the skin, the feeling of the patient. The loral macrogal was first used as sedatives, so the patient would feel very good. And this number 8. And with fibroid T2 hyperintensity, even if we injected the loral macrogal, it was not the ideal one. The ideal one is HIFU combined with loral macrogal. And the number 1, adenomyosis. Cases are not always 100% ablation. So it's different from the singular fibrosis. If you use only the HIFU, maybe there's no impact at all. you will know that kind of cases. You treated fibrosis like this before. After we injected the lower microgo, we see good results. So it's actually a very accurate targeted injection. So this from 2 years, and now the uterus is in normal shape, and she is preparing for pregnancy. So in summary, it is difficult for focused ultrasound ablation of fibroids with high signal ISGE on T2WI. Not only difficult to predict the treatment efficacy, but also difficult to achieve a good effect. Some patients are lucky to have good results. However, we should adjust the inner circulation. When we inject, it is becoming a foam. So we can also reduce the dose. It can be great basis for the result and efficacy. So that's why we are doing the efficacy research to have a new way. If the results do not come well with low intensity, we can still inject more the lower microgo. So this is both physical and chemical approaches to protect our patient, to protect our patient to the maximize. So to conclude, I want to do a test experiment, Springer, a book. So surgical techniques of focused ultrasound ablation in benign uterine diseases. Even for some malign cancers, some liver cancers, with the use of lower microgo, it can also have a good treatment for liver cancers, for not only fibroids, but also other cancers. We can actually think about a good choice of using the lower microgo, and it reduces pain, and it improves efficacy, because it involves lidocaine in it, so we can change impossible to possible. Thank you.